and welcome to Discovery of Eastern Medicine. I'm No Jung-eun. Let me begin things with a little pop quiz today. What is the name of an illness that has dramatically increased in the modern times, with 15 to 20% of the population in most countries suffering from it? It is a chronic disease that is very difficult to cure. All right, your time is up. If you guessed allergies, you're right on. As common as allergies are among today's people, its symptoms are far-reaching and very painful for those who experience it. Ahead on today's show, we're going to get to the root of nasal allergies as diagnosed and treated in Eastern medicine. And to do that, we've invited Dr. Kim Nam-sun. Dr. Kim received his doctorate degree from Kyunghee University's College of Oriental Medicine. He is a member of the Korean Association of Oriental Medicine, as well as the Japanese Association for Eastern Medicine. He was a professor at Gyeongsan Oriental Medical College in Los Angeles. These days, Dr. Kim runs the nasal allergy clinic at Yeongdong Oriental Medical Hospital. He has devoted more than 20 years of his medical career to the treatment of allergy-related diseases. Kim, it's a pleasure to have you with us today. Let me begin by asking you, during the springtime or during seasonal changes, I constantly see people sneezing and with runny noses. Now, what is the difference between allergies and a common cold?
Many people miss the appropriate time of treatment because they cannot distinguish allergic rhinitis from a common cold. Cold symptoms last 2 or 3 days, and at most 1 week. The symptoms of colds include sneezing, a runny nose, fever, headaches, and in severe cases, body aches. On the other hand, people suffering from allergic rhinitis will not have a fever, but will have symptoms of a runny nose, sneezing, and nasal congestion. Additionally, these symptoms last longer. The symptoms are similar, so it is easy to confuse allergic rhinitis with a common nasal cold. Allergic rhinitis symptoms disappear when the weather gets warmer, but recur when the weather gets cold again. If left untreated, it can become chronic rhinitis, which causes facial disfiguration, empyema, and other serious disorders. So it is important to check the symptoms, such as headaches, fevers, and body aches, carefully in order to receive appropriate treatment.
Is hay fever and nasal allergy the same thing?
Allergic rhinitis is commonly called hay fever in Western and European countries. People in the United States and other Western countries say you have hay fever if you have nasal congestion, a runny nose, and sneezing. But most of these symptoms are allergic rhinitis, not hay fever. These two are definitely different, but they are often confused. Hay fever usually develops in the spring, with dry grass and tree pollens being the cause. The symptoms of a runny nose, sneezing, and congestion are very similar to allergic rhinitis, but there is also a high fever. But Western people, by nature, have bodies with more fat and higher body temperatures. Therefore, they show signs of a high fever even with allergic rhinitis. If you have these symptoms when you usually stay indoors and if you own a pet, then you have allergic rhinitis. These people must receive treatment for allergic rhinitis.
Dr. Kim, what are some symptoms of nasal allergy?
The symptoms of allergic rhinitis usually develop around this time of year. It becomes worse in spring, and the symptoms start with a series of sneezes, followed by watery nasal mucus and annoying nasal congestion. These are the 3 major symptoms of an allergy. Let's first see a comparison of the insides of a normal nose and a nose with rhinitis. This is the inside of a normal nose. You can see that the mucosa on both sides are round and clean. This is a photo of a patient with rhinitis. You can see the inflammation of the mucosa. The white things you see on the sides are rhinorrhea. The inflammation of the mucosa causes the nasal cavity to become narrow, making it difficult to breathe. The symptoms of allergic rhinitis are, what is it like when you look at someone suffering from allergic rhinitis? We may feel bad for them during seasons when there is a lot of pollen. They have spasmodic sneezes and constantly sniffle with their runny noses. They have watery, runny noses and have to use up a whole box of tissues. And then they end up with sore noses because of the repeated use of tissues. And the congestion makes it difficult for them to breathe, which can be really annoying.
Could you tell us now what causes allergies in the first place?
그 알레르기 비염의 원인.
The major source of allergic rhinitis is pollen from spring flowers. Flowers are nice, but their pollens are irritating and can cause sneezing and itchy eyes. Also, with the increase in the number of automobiles, pollution has become a serious problem, and allergic rhinitis becomes serious along with it. These days, most people live in apartment complexes, don't they? When the doors are shut, the ventilation becomes poor, and in homes, carpets may be infested by dust mites. 70% of these allergic rhinitis cases are caused by dust mites. Maintaining good ventilation while drying carpets in sunlight and cleaning every corner and crevice carefully will help. Animal fur from pets and cold air may cause cold allergies and allergic rhinitis. In Eastern medicine, an allergy is believed to occur when the humidity system in the body does not function well. To be more technical, it is referred to as liquid toxin, which means there is liquid buildup in the body because liquid is not properly exhausted. So these liquid toxins build up in the lungs, bronchus, and mucosa to react with outer antigens and cause allergic rhinitis. Some people's constitutions are prone to liquid toxin. This occurs with people in the Taein constitution. Taeinins have weak lung function and high fever. 70% of allergic rhinitis patients are Taein in constitution. Among the female population, there are those who have extremely cold hands, feet, stomach, and waist. Female constitutions are normally colder than the males, so their chances of catching allergic rhinitis is naturally higher. These women usually sneeze in the morning. We call this the morning attack. Histamine builds up in the body during sleep, and when the women wake up and run cold water over their hands to make breakfast or open the refrigerator door, they get a whiff of cold energy, causing runny noses and sneezing. There are many allergic rhinitis patients in Japan. This is because it is an island that is humid. In addition, there are a lot of cedar trees there, and cedar trees release a lot of pollen. And their diet does not include spicy food, so the body is cold. Therefore, there are a lot of allergic rhinitis patients in Japan. Children and teenagers are more susceptible to allergic rhinitis. In our hospital, 80% of the patients are children. This is because their mucosa is weaker than those of adults. It must be treated well at an early age in order to prevent it from developing into a more serious disease later on. Let's look at the screen as I explain this further. Sakbin has been in the hospital for 2 months for allergic rhinitis. He's in the 3rd grade now and has had allergic rhinitis since he was little. In his case, his allergic rhinitis has been passed on from his father. 90% of the patients whose parents have allergic rhinitis have been reported to have congenital allergic rhinitis themselves. In cases like these, we have to take on a treatment plan to change the person's constitution.
코가 너무 막혀서 숨을 쉴 수 없었고요. 코가 너무 가렵고요. 뭐 잠잘 때 너무 막히고 그래서 숨을 도저히 쉴 수 없었어요.
In children with allergic rhinitis, it transforms the face. They breathe through the mouth so their lips don't close, which causes the lower face to protrude outwards. It is the same in Sakbin's case. Allergy causes the lower part of the eyes to turn black. See here. The inflammation in the nose makes it difficult to breathe, and it is difficult to speak. They can't breathe, so they can't run. In effect, they lose confidence and become temperamental. Children's nasal passages are narrow, so even the smallest stimulation causes infections or inflammations. But picking the nose or snorting because of the stuffiness will only worsen the wound, making things more complicated. This is a laser acupuncture treatment scene. Normally, regular acupuncture is used, but since children are afraid of the needle, we stimulate the meridian using an ultrasound and laser. It has the same effect as acupuncture treatments. People who are afraid of acupuncture have no problem with this treatment. It was introduced as an addition to traditional Oriental treatment, and it is very effective for infections and inflammations of the nose.
제일 하고 싶은 게 전 코 때문에 말이 잘 안 나오거든요. 말을 좀 똑바로 해야겠어요.
좀 좋아지고 있다고 그러니까요. 좀 지켜보고 좋아질 것 같아요. 지금 그리고 조금 입도 좀 다물어지고 있는 것 같고요.
Sukbin followed the treatment well and took his medicine as scheduled. He should be able to run like normal children in 3 months, and he will be able to talk clearly as he had wished.
I've lived in the United States, specifically in Iowa, for more than 7 years. Around the end of my staying in the state, probably a year before I left or two, it started with the symptoms of runny nose, coughings, and dropping tears. Especially when you feel really tired or you feel a lack of sleep, that kind of symptom went really bad.
This patient was a student in Iowa in the United States and developed allergic rhinitis there. It's cold in Iowa, so it is easy to catch allergic rhinitis. He was treated in the U.S. for hay fever, but there was no improvement. This allergic rhinitis got worse when he came back to Korea after his studies. Air pollution and dust were some of the factors that aggravated the symptoms. It's been a month since he came to our hospital. When he first came to the hospital, the inflammation in the mucosa was severe. It has gotten a lot better now, and there's less rhinorrhea. This patient is being treated with medicine, acupuncture, and aromatherapy. Here, we're using aromatherapy. When eucalyptus oil is diluted in water and inhaled like this, it acts as a disinfectant while alleviating symptoms of runny and stuffy noses.
When I started with this kind of treatment, those symptoms have been gone almost zero level, and I feel very happy with this kind of treatment.
We've now seen 2 patients. It's not easy for those constitutionally prone to allergies to live in an environment totally free of allergens. Therefore, the principal treatment plan for allergic rhinitis is not only to remove the allergens from everyday life, which is important, but it is more important to make the constitution stronger against the allergy. Oriental treatment does not remove the symptoms temporarily, but treats the symptoms while changing the basic constitution as well.
Well, we've certainly seen a couple of your patients and how they're treated with the methods in Oriental medicine. Now, could you explain in more detail what other kinds of treatment, plus more details on these treatments that you've used on these patients to us?
예, 이제 주로 이제 한의학에서는
There are several treatment methods for treating allergic rhinitis. The most important thing is to remove the liquid toxin and fever from the lung. So, for treatment of allergic rhinitis, a formula called socheongryong is used. This formula, when digested, is very effective in releasing the liquid toxin through perspiration and urine. An effective treatment can be achieved in a short period without any side effects. Aside from taking the socheongryong formula orally, it is also effective to inhale the vapors of the formula. This is a method of stimulating the mucosa and absorbing the medicine through the skin. This is usually prescribed to those showing rejection symptoms to herbal medicine. The effectiveness of the socheongryong formula has already been presented at the 8th Scientific Meeting of the Oriental Medical Society in 1995 and the American World Society for Oriental Medicine held in Las Vegas. Acupuncture is used as an adjunct to herbal medicine. Among the channels referred by Oriental medicine, the channel most closely related to the nose is called the governing vessel. This channel starts from the tongue and goes up to the head, down the spine to the buttocks, passing the central line of the body. On this channel, there is a point between the eyebrows and a point around the wings of the nose where we apply acupuncture. The web between the thumb and the index finger is known as the godfather of rhinitis treatment. That's how quick the effect is. Although laser is not a traditional Oriental technique, it is used as an adjunct therapy. The light energy from the laser turns into heat energy on the skin, which activates the life energy, enhancing the blood activity and solidifying the immune system. Therefore, it can be used to treat the root cause. In addition, there is aromatherapy, where treatment is carried out with fragrance. Usually, eucalyptus mint fragrance or pine fragrance is used to treat allergic rhinitis. This is a thymus scent. Let's have someone from the audience smell this.
How is
Doesn't it smell good?
향이 좋죠. 예. 코가
The nose gets tangy.
Is that, do you just have to sniff it? Is that all you have to do? You just have to sniff it? Do you add anything
요거는
else?
이제 그 면봉 있죠. 면봉
Put a drop of the fragrance on a Q-tip and apply it to the mucosa. Another way is to take a drop or two and put it on a handkerchief or Kleenex or napkin and inhale the fragrance that way.
그러니까
The theory of aromatherapy is that the olfactory nerve will pick up the smell and send a signal to the brain to release the endorphin, which will be effective in controlling pain and increasing resistance.
병원에 오지 않으시고
Aroma fragrances can be purchased outside the hospital in department stores or specialty shops that carry aroma products. So you can purchase it and use it at home.
그래서 이제
This should be very useful.
도움이 됩니다.
Well, so 1 or 2 drops, that's all that it takes to relieve some of the allergic symptoms. Now, are there any other such easy ways to treat your allergic symptoms at home?
또 이제 알라마 세라피
Other than aromatherapy, there are also finger pressure therapies.
한번 이렇게 보여.
Shall I demonstrate some finger pressure therapies?
I'll be there.
Miss No, why don't you help me?
여기 이제 양손이요. 여기 이제 합곡.
These two hands are called Hopcock meridians. At the web between the thumb and the index finger, there is an indentation. This is where the Hopcock meridian is located. Press the Hopcock meridian several times. Press both sides.
코 양쪽이 영양혈이거든요.
Then the wings of the nose are called the Yanghyang meridian. And then at the center of the eyebrows is the Indang meridian.
그리고 이제 이렇게 그
Press here like this with the thumb for several seconds.
지압을 이렇게 수철씨 이렇게
Press going up the nose.
올라가면서 눌러주고요. 이렇게 눌러주고 또
Then
내려오고
down again, comfortably applying pressure.
지압을 하시고요. 그다음에
Then press here at the Indang meridian lightly.
이렇게 압박을 해주죠.
See, well, you don't even have to press very hard. It's just kind of a soft pressure added.
네, 이제 약하게
Press it lightly, then a little harder.
이렇게 해서 한
Soft and firm. Soft and firm.
yes 그렇게 해서 한 10분
The symptoms will feel better if you do this for 10 minutes 2 or 3 times a day. And in the back, there are the Dachu and Pungji meridians. In the back here, at the nape of the neck where the bone sticks out, press the bone. Or instead of the finger pressures, most everyone has a hair dryer, right? Apply warm air from the dryer to this meridian. Apply for 1 minute, then rest 2 or 3 minutes, and so on, 4 or 5 times a day.
그다음에 이제 생리식염수 있어요.
When you have a stuffy nose, there are saline solutions, and these saline solutions are sold in drugstores. Warm solution, using a squirt, spray in one side of the nose, and when it goes over the throat, spit it out and repeat on the other side. This will be effective in relieving the stuffy nose and treating the infection. And the last home remedy I want to tell you about is Youngji mushrooms. Youngji excellent. You all know Youngji mushroom, as well as dates